Edina. Edina.
Let's get started.
It was so cool.
After you say the right one, get started. Everybody here?
Everybody here. Ready?
My own fault. Okay.
Here.
89. My own fault. 100%. It is, but I don't want. Okay, everybody ready? What do you think these three things represent?
The foramen?
No, that's a salivary gland.
Papa bear, mama bear, baby bear. Right?
Right?
Okay, what's Papa bear?
Carotid.
Okay, what's mama bear?
Submandibular.
Sublingual. Closed. Or encapsulated. Papa and mama. Which one
Papa.
is not encapsulated?
The baby.
Baby bear. Baby bear, what duct we usually, well, there is one duct that's associated with it. Bartholin.
Barton.
Remember Bartholins? Okay. Submandibular. Remember what duct was
Barton.
Yes. And Wharton. And that's, what about carotid? Stens. It's actually stens. Yeah, a Stenson duct, okay. Stenson duct goes through what muscle?
Masseter.
Buccinate, okay. So we have that, and then we have that carotid papilla. You know, when people look at it and they go, ooh, what is that? Oh, pathology. No, it's carotid papilla. Remember that? Okay. What else do we need to know about? So this is encapsulated. So we're going to run into those.
Serous.
Which one produces the most saliva?
Submandibular. 60 to 65.
Okay, which one? This is about
25.
Yeah. This is about what? 10%. 10%. Most is about 60%. Most here. Oh, thank you. I'm a better one. Thank you. Thank you very much. Okay, and then this is mostly what type of saliva? Serous. Oh, much better. Serous. Okay. And this is kind of both, right? Both. And mama bear does everything, right?
Yeah.
And then baby bear is mostly what? Mucus, because baby bear is always kind of slobber. Okay? So there is a fair number of questions on the salivary gland. If you have, there's also these little accessory ones that don't have ducts. Oh, if a gland has a duct, is it called, what type of gland? Exocrine. And if it doesn't have a duct, and you got that, you already got 1 point. Or maybe 2. Okay. There's 100 questions. I think we'll be out of here in about an hour. I'm sitting there thinking, if I do less than a minute per question, there's 100 questions. That's about 50 minutes, but we may linger on 1 or 2. Okay. So you should, an hour should be it. Yeah. Okay. What else we need to know about ducts? How about the lacrimal gland? Okay. That kind of has a duct, right? Yeah. Okay. And what does the lacrimal gland make? Tears. Lacrimosa. There's some. Lacrimosa. Okay. That means crying. Okay. Let me see. Let's start where we are and do these. All right. So is the lacrimal gland a major salivary gland?
No.
I just gave you that first one. So when you start out, you'll go easy. Okay. All right. Okay. Let's talk about some papilla on the tongue. Papilla. A lot of times are taste buds, right? When we think of the taste buds, can you name the papilla? Okay. What are the ones along the side called?
Foliae.
What about the soft ones? They're very numerous. What are those called? Filiform. Right. What about the ones in the back that kind of form? Circumvallate are special because they have salivary glands, right? And what are those glands called? Von Eppner. You guys are geniuses. Okay, you already know like 10 questions, so you know that 10%, right? Of the whole test. Okay, so that's really good. What other? Did we miss any of the salivary glands? Oh, we have fungiform. Okay, that has. And do the filiform, do they have taste buds?
No.
Okay, we're real good on that one. Okay, how about their salivary glands and the mucosa, that kind of minor salivary glands, right? And those don't have taste buds, right? Do you find minor salivary glands on the attached gingiva?
No.
I can't really see that you would. Okay. Okay, we got the first page down. And you guys have already got the first page down. You know, these questions are not hard. I don't know. If you've missed them, it's because you're getting too nervous. They're straightforward. You know this material, okay? So when you sit down and take the test, be cool, and you'll get it, okay? Okay, well, here's one. We have ligaments that are associated with the TMJ. Okay, can you name those ligaments? Okay, we have the TMJ ligaments. Okay, then we have stylo,
Mandibular.
thank you, sphenomandibular. And which one of those is attached to the lingula? Sphenomandibular. And that one, we kind of go through it. They say it's kind of a landmark from the IA, for the IA, inferior alveolar, because it's right over. Remember that lingula is right over that mandibular foramen? Can you all see that on the mandible? Okay. You know where that is, right? It's attached there. I don't call it a landmark. I think landmarks are things you can see. You can't see that, but you sometimes can feel it. You might go through it. Got it? Okay. If you have a salivary gland, it's a little minor salivary gland. You cut it and it gets kind of bubbles up a little bit because it's stopped up. What do you call that?
Something is starting with MU.
Yeah, mucocele. How about a major salivary gland that gets stopped up? Do you remember what that is? Granula, meaning what? Frog's belly, right? Frog's belly. Okay. Pus and suppuration. I guess that's what you want. That's a real question. Okay. I'm just going to tell you this question. You can look it up because I'm not quite sure what she wants here as far as the answer. So you guys, I'm not going to give you the answer. Okay. So another word for pus. You know. Yeah.
Abscess.
Yeah, so that kind of absent. I'm going to ask her about that one. I think it's kind of a funny question. So,
No.
yeah. So
Is it
she has ptosis. It's obvious. What is the word? What does ptosis mean? Ptosis is when your eye goes. If you all know what a fistula is, right? That's sort of a tract where you have an infection. It goes through a tract like it's in the bone. It comes out. That's a fistula. You should know what that is. What's dyspnea? Dyspnea. All of these things are on, there's a list that she sent you, okay, and it's on infections. It's just a bunch of words, and you can get that one.
On the last one? The last note?
Dyspnea, okay, so I want you to get that and look all those up. Can you do that? Yeah. Okay. So I would look over that one. That's one that she did not go through in class because all it is definition. But she has some of those definitions on the exam. Does everybody get that? You can get it from, what do you call that? Canvas? It's on Canvas. Download it. Know the definitions because some of those, maybe 4 or 5, will be on the exam. Got it? Okay.
And the name for pus is suppuration.
Yeah, so look it up. I'm going to ask her which one she, I'm sure she, but see, there's a few things somebody might say, well, fistula, they have pus coming out of fistula. I don't like ambiguous questions that you just kind of, that's not very close.
There's more than one right answer.
Yes, exactly. And neither does Dr. Tina. We found a few that had more than one when we were going over our farm exam. So we're going to change. Okay, but you're not taking a farm exam, so it doesn't. But it's the same with this one. Okay. If you what is the word for if you can't swallow very well? Do you remember what that word is? It's going to be what? Dysphagia. Like a phagocyte is something that eats, right? Like dysphagia. So look up those words. Those are all the words that are on that list. So look up some of those words. You know, shortness of breath. What's the word that means shortness of breath? What's the word that means it's difficult to swallow? What's the word that means your eye is kind of drooping? So all those words are important words to know because when you're writing charts, you want to write the proper words. Okay? You know, we already went over that. Okay, that one is on the list. That one's on the list. Yes. So that one. Okay, that one's on the list. Okay, what is this? Okay, I'm not going to go over every one of them because otherwise I'm going to give you every single answer. I'm not doing that. Okay, so I'm going to make you work a little bit. Okay, so look on that list. I'm not going to tell you what exactly is on there, but you should know all of them anyway. Okay? What is this? What do we call that? Protrusion. What do we call this one? Look on my back. My mouth goes back. Retrusion. What about this? If I do this, my mouth opens. There's a other one. Depressing the mandible. That's a tough one. People get that confused. But opening the mouth is depression of the mandible. Closing the mouth is elevation. Doesn't sound like it's right, but it is. And I don't want you to have a question that has that, and then you get confused because you're not understanding that opening and closing are elevation and depression. Okay. Got that. Okay. Let's look at the tongue as far as I'm going to erase this. We'll get a few questions really quickly with this. because there's a number of questions about the tongue and its innervations, and I want to make sure you all know it. Here's our tongue. Remember the tongue?
Yeah.
Okay, what's this thing called in the back?
Terminus.
Very good. Remember the sulcus terminalis? Yeah, in the front of it we have what kind of salivary gland? Valley. Yeah. Near this valley, there's a little valley, because there's a sulcus terminalis. Okay, this is called the anterior or the body. Anterior 2/3, right? This is the posterior 2/3. Okay. And that's the base, right? Okay, what taste and sensation? Base. What cranial nerve is that? Do you remember?
Glossopharyngeal.
Yes.
Number 9.
Boom.
Okay. And what number is it? 9. Thank you. And this big part, because it's big, there's two nerves that handle taste and sensation. Okay, taste is what? What nerve?
7.
7. And what branch of 7? Chorda tympani. Remember that? And then what about sensation? Pain. That's 5. It's V3, right? It's the third division of the 5. Okay. Now V2 is there muscle? Let's go to cranial nerves just a little bit because we're kind of on it. Oh, lingual nerve. This is the lingual nerve branch. Okay. Anything else we need to know about that? I don't know. Maybe.
Chorda tympani.
Yeah, chorda tympani is 7. Chorda tympani also goes to 2 salivary glands that are near and dear to you. That is the sublingual and submandibular. Okay? Yes. So chorda tympani is a autonomic, parasympathetic. Okay, cranial nerves, just for the heck of it. When we talk about V1, V2, V3, that's all trigeminal. Okay, V3 is the only one that has muscle and sensation, right? Then V2 is only sensation, maxillary region. V1 is more up here in the eyes, okay? V3, what foramen does V3 go through?
Spinosum? No.
Ovale. Remember how big that is, all right? Okay, do you have models? I don't see that many models. You should look at that and remind yourself of what that looks like, okay? Remember the foramen ovale. The one that goes for V2, that goes forward, is foramen rotundum. Remember that? V1 goes through the what? Superior orbital fissure. Remember that? Long time ago. Okay, I would kind of remember those because there may be some questions. Got it? There's kind of way back machine for that. Okay. So here we got that. Okay. Let's see. Okay. Remember the anterior and posterior fossal pillars? That's when we were doing the palate and all that. What is it between the anterior and posterior fossal pillars? There is a what? Tonsil. Remember? Yes. There's a tonsil that goes, and the one in the front is the anterior fossal pillar. That's the palatal. It's the portion of the palatal glossus. The posterior fossal pillar, palatal pharyngeus. So just kind of get that back there. You may want to review that. If that's kind of like, in the middle of those two is that palatine tonsil, and it drains to a particular node. Yes. Jugular digastric. I think a lot of you now remember because a lot of you got it wrong.
Yes.
Sometimes when you get something wrong, we like to repeat it. Okay. Does that make sense?
Yes.
No. Okay, great. With that.
Did I?
Yeah. With that. Okay.
Number 8. Number 8. Number 8.
Oh, that one I know.
8.
Oh, that is wrong. Okay, she has this down. It's not one that I emphasize a lot. I didn't do that much anyway. Okay, so we have for the salivary glands, the sublingual, submandibular, chorda tympani, 7, right? Parotid, we know that 7 goes through it. Does 7 innervate it?
No.
What innervates the
Glossopharyngeal.
guys are geniuses.
This
Okay.
one.
Did everybody remember that?
I didn't know that.
What? Okay,
Missed
good.
on the test.
Uh,
So she knows now.
That one? No, just this one.
This is a funny question. I'm going to talk to her about that one. I got some funny questions I want to talk to her about. But sometimes, I think this is what she's talking about. Sometimes you have that maxillary sinus up here. It can be inflamed, and it'll cause some discomfort in your teeth. I think that's what she's talking about there. But I'll ask her and make sure that. Okay, when you're talking about cavernous sinus thrombosis, remember that one there? And that can be caused by all kinds of infections in the head and neck because we don't have valves. Travels through the veins. Okay. So I would just gotta get that in your head. This one is a funny one. Okay, so sometimes with, I just got more than one, this is funny. Okay, cavernous sinus thrombosis can cause some drooping of the eye. Is that true or false? Can it do that? Can the sixth cranial nerve a little bit? Yeah, it can cause a little bit of that one. So, and remember what diplopia means? That doesn't sound familiar to you.
No.
Okay, that was at the infection, I think maybe the last. She said, okay, I'll let her know that this one, you're all going, huh?
Yeah.
All right.
Diplopia is double vision.
Look up diplopia. Okay. And did she say anything about the abducens nerves and cavernous sinus?
Is there?
Which one?
Okay. Okay, hair loss, no. Gotta be done. Some of these, I'm looking at this, and some of these you can go by the process of elimination. Okay, so you know where the cavernous sinus is. It's in the brain, right? Think about this. You know the sixth cranial nerve is up there in that area, right? Now, if you had an infection that's going to affect the sixth cranial nerve, right? And they said, okay, what could it possibly cause? You kind of do a process of elimination. If one of the answers was hair loss, would you say true? No. No. Okay. So read these questions because some of them are going to be very obvious what they are. Okay. And I will ask her about that one. I wish I'd gone through some of these. Okay. This is repeat. We've got too many repeats. Now, the problem with the repeat is if you get it wrong once, then you get it wrong 4 times. It's not fair. So, we don't want to do that. Okay. Okay. TMJ. I would know the anatomy of the TMJ is where the articulum eminence is as opposed to articular fossa, okay, as opposed to subglenoid process. Can you all imagine that in your heads? Okay. I'm not going to tell you the question. I would tell you to know that anatomy. What's in the front, what's in the middle, what's in the back. Can you do that?
Yeah.
Okay. We already did that. We're getting there. We're third term. How was that time? Not bad.
Is that 70 question or one?
There's 100, but we're already up to question 32.
Fuck.
You know where all these lie, right? All these, the glands, okay? Okay, you all know where the sublingual fold is?
Today.
Where is it? Where's the sublingual fold?
Under the
Yes, okay. And you all know what the dorsum of the tongue and the ventral surface of the tongue is? Okay, it's backwards, right, okay. Some of these are really easy. This is a repeat. Too many repeats. Okay, all right, okay. Let's say you have a patient and you look right here, do an exam, and this whole area is really swollen. What could they possibly have?
A goiter.
It's goiter. Mm-hmm. And what is goiter? What gland is that?
Thyroid.
You're all gonna get A's. Got that one. That's a repeat too. You know, there's gonna be some that are. Okay, what 2 bones make up the zygomatic arch? Do you remember that from a long time ago?
Zygomatic process of temporal bone.
Yes. And what's the other one?
Temporal process.
Temporal process. Remember the temporal process is zygomatic bone, and the zygomatic process is temporal bone. Okay, and the 2 together form the zygomatic process. Okay. Do you remember back in? There's not that many questions on embryology, but you remember Meckel's cartilage?
Yes.
Okay. And what structure will that help form? It doesn't become this structure, but it helps form. It's sort of a substrate for it.
Second
Remember?
arch
The
mandibular.
mandible. Remember that? Mandible? Okay. That was a long time ago. So it kind of helps form the mandible. And that's one we do want you to remember. And it's a common one to see on the board. They just love questions like that. Okay, the PSA, that nerve. Okay, first of all, that nerve, the PSA nerve, is part of what cranial nerve? It's a branch of which? B1, B2, or B3? B2. And the PSA, what teeth does it go to?
Molars.
Molars.
Maxillary molars.
Maxillary molars. Possibly not the mesial buccal root of the first molar. That could be done by the which nerve? The MSA. Okay? And that MSA usually goes to the two premolars, right? And then we have the ASA, that's usually from the cuspid forward. And also all of this is the buccal mucosa, not the inside, but the buccal side on the outside also. Now, the thing about the MSA and the ASA, they're not directly branches of D2. They're branches of the infraorbital, right? The infraorbital comes out here, right here. Remember that? The infraorbital foramen? Right. So if you inject right here, you can put some pressure on it, push it back in, and then hopefully you'll get the MSA and the ASA nerve. So with one injection, rather than two, you can get all these teeth in the front. Okay. So this, as long as we're talking about the infraorbital, which is here, what bone is it coming out of?
Infraorbital. No.
Yeah, but what bone? That's the infraorbital. What bone is that in? This is a question that was asked last term and everybody got it wrong. Okay. Take a look at your model. That's why I want you to look at your model so you can see it. Okay, take a look.
Maxillary.
Yes. Okay. Everybody look at that. Look at the infraorbital so you won't ever forget it. And that's one I really want you to know. It's on the skulls. Look at the skulls, find the infraorbital foramen. You absolutely should know where that is because it's an injection you will be doing. Okay? And if you can't imagine where it is, how are you going to do that injection? Got it?
Yes.
Okay. If you don't have a skull now before you leave, look for that. Please. Okay? Alrighty. So again, the infraorbital foramen is in which bone? Maxillary. Maxillary is where? Right here. Is the maxillary a cranial bone? No, it's a facial bone, right? How about cranial bones? Those are the ones that are inside the cranium, the one that kind of hold the brain together. Sphenoid bone, that's a cranial bone, right? Sphenoid bone? Okay, now how about there's paired bones and singular bones, okay? One of the singular bones would be the sphenoid bone, right? Remember that one in the middle, kind of means a wedge? Okay, what about the boner? Boner, is that paired or single? Single, that's a single bone, right? A lot of them are paired, parietal, right? Temporal, right? So those are all paired. Even maxillary, it seems like one bone, but you have one half and the other half, that's a pair, okay? What's that? B2 goes through which one again? B2 goes through which foramen to get out of the cranium? Foramen rotundum. Okay, B2. And then we get some terrible palatine pop off. Okay. Okay. Which one has the motor branches of the trigeminal? Which branch or which? B3. The other two only sensory. The other thing I want you to get into your brain because there's a bunch of questions that have this word in. You need to remember this. If it's motor, that means it goes from brain's got to take the signal to go to the motor. We call that efferent nerve, E. E stands like exit, okay? If it's sensory, that's afferent starting with an A. There are questions like that, so you need to know the difference because it may just be, is this one an efferent or afferent? You got to know what that means, okay? You all got that? Yes. Thank you. I like that. I like nice and loud so I can hear. I don't have a hearing aid today. I can't hear very well, so I like the big voices. Thank you. I don't wear my hearing aid because I find everything is too noisy. Come in here. Okay, where are we? Okay, now that. We're already up to 43, so we're getting there. Okay, I wanted to have you out earlier, but I'm spending too much time.
Don't mind.
Oh, you guys are sweet. Okay, maybe it'll be an hour and a half. Will you be okay with that?
Yeah.
Okay. Okay, we're talking about gingiva. Okay. And we're still talking about V2. Remember V2? And we're talking about nerves that go to the gingiva. Okay, so when we talk about the palate, and I want you to know this because you're gonna need it for next term. Okay, we try to get B2 and we have the PSA, the MSA, the ASO. Say that takes care of the nerves that go to these upper teeth, right?
Right.
Part of B2. And also the outside, but it doesn't do the inside. The inside is two separate nerves. The anterior from like cuspid to cuspid in a little triangle, that's which nerve? Nasopalatine. Okay, it goes out of which foramen? Incisive. Know that. Know where the incisive foramen is. If you don't know that, look today. The other one we do, that's for the rest of the palate, is what nerve? Greater palatine. And what nerve does that come out of? Or what foramen? Greater palatine foramen. Now, a really hard question. The palate is made up of two bones, right? Maxillary bone, right? And also the palatine bone. What nasopalatine is which bone?
Nasopalatine?
Yeah, what that is made up by the nasopalatine foramen, okay? Or incisive foramen, excuse me. That's in which bone or which bone's coming together? Maxillary. That's right, yeah. The palatine process of the maxilla. Okay. What about that great palatine? What bone is it in? Is it in the maxilla?
No.
It's in the palatine bone. Everybody get that?
Yes.
Okay, look on your skull, remember, and these things we're going to emphasize because it goes right into next term. And you're going to ingest these. And these are the ones I really want you to know because you're going to be poking in these areas. Okay, let's keep going. Okay, we're almost halfway through this. Doing this. Okay, if you have an infection on the tip of your tongue, where is it going to, primary nodes it's going to drain to?
Submandibular?
Sublingual. Yeah, okay, so submental in this case, okay. That's good.
Submental was the last answer?
Yeah. Okay, most of the teeth, though, are going to go to which nodes? Most of the teeth, not the front ones, not maxillary third molars. They're going to go to which node? Submandibular. Got that?
Yes.
Third molar, where does that go? Superior deep cervical, right? Remember those? Those are the ones that are along here. Now with these, the superior and inferior deep cervical drainage, what muscle is associated with those? Sternocleidomastoid. Right. You kind of have to move it aside. They're deep, so they're kind of underneath it, but you can feel them. Okay. Okay. Is the flexinator a muscle of mastication?
No.
It sounds like it should be, but no, it's not.
No.
Okay, remember the muscles of mastication. Okay, masseter, temporalis, the medial pterygoid, lateral pterygoids. That's it. And all the others are facial. Facial muscles of facial expression. What nerve is that? 7. Okay, muscles of mastication. What nerve is that? B3. Exactly. Okay, so if your mouth goes from this way to that way, what muscles are doing that? Lateral pterygoid. If you're elevating your mandible, there's 2 muscles that we talk about. What muscles? There's 3 actually. Yeah, temporalis. What else is there? Medial pterygoid and masseter. Okay. The masseter has 2 heads. Remember that? Superior and deep. Right. So we have 2 heads on that. And the mandible, that all of those elevate. Now the temporalis also can retract. Right. Retrude, retract. Remember that one? Then it goes like this. It can elevate it, but these fibers going this way can retrude the mandible. Those are all muscles of mastication. Any confusion on that? We're getting there, you guys. Okay. Where does the mandible, the masseter muscle originate? And remember origin and insertion. Origin is where it's stuck. What is that again? The zygomatic arch. Okay. What about the temporalis muscle? Where does it originate? Kind of up here, right? Where does the temporalis muscle insert? Coronoid process. Remember that? I don't think there's a question, but I just wanted to know if you knew it. No, people are like, wait, I want to know more than I know. Okay. Yeah, I would know a fair amount about the, I'll show you what picture you should look at. There's about 3 questions on this. Okay, we're getting there. Don't
for you. Are you guys okay?
It's all right.
This will save you time later. I know it's time.
Right?
Okay. Everybody. Do you remember this picture?
Yes.
Yep.
Know this. There's about 3 or 4 questions on this picture, which I sent to you, okay? All right, okay, with lymph nodes, if something is draining out of a lymph node, that would be kind of an efferent duct, right? Exit. So there is one question. But you should know the drainage, that the right area, okay, the right lymphatic duct, it's just duct, it takes care of just this little bit of the right side. Most of it, the thoracic duct is the left side. Can you see that?
Yes.
And there is some questions on that, okay? So that drains most of the areas. So do get a picture of that. She's not going to say exact or ask, I don't think exactly. It joins the venous system at the right subclavian and right internal jugular. I don't think it's going to get that specific, but just sort of understand this picture, okay? If the first place that a lymph node's going to drain is, what is that called? Those are the primary nodes, right? So I would know that. So that's important with cancer. If you have cancer and it just goes to the primary drainage, it's not as bad as if it's going beyond those primary to the secondary nodes. That's why that's important. Where they first go, that has to do with staging. Oh, let me forget my phone. I do that. Okay, what else? La 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 la. We're getting there. We're beyond 50 now. Okay. Yes. Oh. You all know what adenoids are?
Yes.
There's another word for adenoids. Do you remember what they're called? Okay. The pharyngeal adenoids, pharyngeal tonsils. Okay. So just kind of know that the adenoids, sometimes they take them out with tonsils, but I had my tonsils out and I had my adenoids out, you know. So the adenoids are the pharyngeal, they're kind of back further. Yep. Oh, here's one you've had before, maybe. Okay. Again, I'll say this again because you all got it wrong last time. Palatine tonsils drain to where? Jugular digastric, right? That's the prominent node. So I think I just got more than one. I'm gonna have to go through this. Okay. Exocrine glands have ducts or don't? Okay. You know that.
Outside.
Exocrine glands have ducts. Endocrine glands don't. Which is the largest of the major salivary glands?
Parotid.
You all know that one. And you all know the innervation, so know that one. Oh. What is it? Ow. Where is a muscle model? We have a muscle model?
Yeah.
Okay. I'm going to have you take a look. I want everybody to look at this. I don't want you to get this wrong. What is this muscle right here?
Masseter.
Thank you. Thank you. I guess I will call 911. Okay, master.
An hour later.
And then what is this yellow thing right here? What is that?
Parotid.
Parotid. Okay. What's underneath? The masseter. What's on top? Parotid. The parotid wraps around the back. That's why you have to be careful when you're injecting, because inject on the inside, you go to the end, and you could end up in this. You're not going to inject through the masseter and get it that way. No, that's impossible. Where's the mandible? The problem? Can I have a mandible? Oh, thank you. I'll take a little mandible and then we'll get going. Again, I'm doing this just because it's... So, here's our little... So the masseter's here. On top of that's parotid. Parotid goes around like that. So when you're injecting, to get to that thing, if you go this way, there you are, the parotid. Okay? Because it wraps around the back of the mandible. Do remember that. Okay. You're all going to be so ready for next term. All know what Ludwig's angina is, right? Okay. Swelling. Okay, you all know Ludwig's down here. And what space? Remember, it's submandibular. Do you remember that? Okay, Ludwig's angina can cause what? Cutting off of the breathing. Okay, that was that real serious one with the Ludwig's, with the guy who's all in.
Oh, yeah.
And now, the way I learned it, really to truly have Ludwig's angina, you have to have swelling on both sides. That's how it cuts off the breathing. A lot of times it would happen when people had extractions on both sides, like that 32 and 17 extracted, and then they both get inflamed, and you got it on both sides. But I'm hearing it can cross over and cause it that way. Okay. If somebody has TMJ, right, and you hear all this noise, does that mean they have TMJ syndrome? Not necessarily. So really when we're talking about TMJ, you get this TMJ clicking, but they don't always have to have it fixed if they don't have pain. Okay, that's a weird question, but it has to do with false. Yeah, yeah. Okay, what's primary sinusitis? This has to do with sinuses. That's when the sinusitis, itis means inflammation, right? Anytime you see itis, that means it's starting in the sinus, okay? So let's say you have a cold, that's like a primary sinusitis. But you can also get it if you have tooth infection and it's going from the root of the tooth into the sinus. So that would be like a secondary sinusitis. Y'all know where the foramen cecum is, right? And what it is. Remember that way back? The foramen cecum?
Yeah, on your tongue. On the tongue.
Okay, right. And what is it's associated with what gland? Remember that one? Thyroid. Remember that one? That in embryology we have the foramen cecum, and it's the site where the thyroid gland started and then goes down into this tract and finally settles through embryological development into the spot where it ends up, which is here, right? But the tract sometimes still remains, and we need to know this, and sometimes people will get little cysts along that tract. The tract is not really closed off. Okay? You know the foliate papilla, you know where those are? We're getting there. Okay, and you understand the spaces, and the spaces that infection, it goes a path of least resistance. She talked about that a lot, right? So if you're going to have an infection, we travel through those spaces really fast. It's hard to get into that muscle. It's all surrounded by all that tissue and stuff. But if you get an infection, it's in the space that goes, woo! You know, so we'll go down here. Another one. I got to make up some new questions. You got some real giveaways here. So. Efferent, and I've got another question with afferent and efferent. No, those. Okay, those are confused. The IA nerve, what is the IA nerve? When you inject that inferior nerve, it's what does it go to? It goes to the mandibular teeth, right? It also dips out and comes out as a mental, right? The mental branch, and that will go to the outside from premolars forward, right? So all the mandibular teeth, the soft tissue from premolars forward. What nerve, which is a branch of D3, is going to take care of the soft tissue on the buccal? Don't get buccal and lingual. There may be a question like this, and the only thing wrong is buccal or lingual, right? Don't do that, okay? Buccal side, what nerve is going to take care of the molars? Remember? Yeah. But what is it? The long buccal nerve. IA doesn't do that. Let's do it again, real quick. You guys need to know this for next time. I'm going to spend this a little more time. A little more time, okay? We got the mandible. Okay, the mandible. This is the inside of the mandible. This is the medial surface, right? Medial. Okay. IA nerve. Goes through there. Comes out here. Mental foramen, right? Then goes to soft tissue from here forward. And then this is called the IA, right? Take care of the teeth, right? These are teeth. Very bad teeth. Okay. Takes care of those, all right? And it takes care of soft tissue from mental forward. Also does these called the incisive at that point. Remember that? It's a long time ago. But we have a problem. We don't have soft tissue because it's all inside the bone. We can't go to soft tissue if it's inside the bone, right? Mm-hmm. So we need another nerve to come down and take care of that. What's that called? The buccal nerve, right? What about the lingual? No, does not take care of that. It's teeth, soft tissue to the IA. Teeth, soft tissue from mental forward, which is premolars forward. Okay, then we get a long buccal for the soft tissue buccal side, right? Then we have a lingual nerve, separate nerve. It's going to go to all the lingual, the tongue, the inside soft tissue. Okay, if you don't get that, try to get it, okay? It's easy for me because I've been doing this for a bazillion years. Harder for you because you started. If that's hard, read it again, okay? Because that's one of those really important things.
It's like a 4 times thing.
Okay? What does that all come from? B3, right? They're all B3. So again, B3, IA. Where does it go through? It goes through the mental foramen. As it's inside the bone, can it go to the soft tissue? No, it's inside the bone. But what else is inside the bone? The roots of the teeth, right? So they take care of the roots of all those mandibular teeth. Yay! But there's one place where it pokes out. That's that mental foramen. So we do get some soft tissue, right? That's from premolar forward. That is the mental branch of the IA nerve. What separate nerve from B3 takes care of the buccal tissue on the molar? Long buccal. What other nerve from the B3 takes care of the lingual nerve? The lingual. Thank you. You're going to need to know that for next term. I really want you to know that. Okay. We're at 75. We don't have that many more. Can you hang out 15 more minutes?
For sure.
Go for it.
Make it.
Let's do it. We can do it.
Okay. Do it. Make it.
Okay, we already did that. Okay, remember that before this branches off, we have this little mylohyoid nerve that's a branch off the IA, right? Remember that, and it goes to the mylohyoid muscle. I don't know if you remember that one, but I want you to remember it down, mylohyoid. Remember that mylohyoid muscle, the floor of the mouth. But this one also can take a little branch and go to the first molar of the mouth. That's why sometimes you numb somebody up and their first molar is just not numb, because the mylohyoid nerve, which branches off the IA before it gets into the mandibular foramen, easy for me to say, right? But it sometimes will go to that first molar. All right, that is, we did go over that, but it was a long time ago. All right, so, but if that's confusing, go ahead and look at the kid. Okay. Also, for those that are taping this, hello. Oh, is that me?
Beautiful.
For those that are taping this, sometimes, and I've said this a million times, my brain and my mouth don't hook up quite right. This happens when you get older. Just you wait, it'll happen. Maybe it happens now. Something I say does not make any sense. It's probably because it doesn't make any sense. All right? But it's up to you to kind of question everything. I would say probably 95% of what I say is right. Okay, but you better watch out for the 5. Okay? Even when I'm talking here, you kind of go, wow, just say something. So that I'll be, oh, did I say that? Okay. Got it? Promise you'll yes. Okay. Anybody that says they're perfect is lying. Okay. Okay, we all know where the buccal is. The buccal take care of the gingiva on the lingual or the buccal.
Buccal.
Yeah. I mean, it says buccal. Oh, the buccal nerve takes care of the lingual. Well, how silly would that be?
Even I know that.
Yeah. I would think somebody that didn't even know anything about anatomy could know that.
Should do a poll.
Okay, if I chew and chew and chew and chew, what muscle is going to get big and fat? Okay, what muscle? What muscle did I hear? Everybody, what muscle? Thank you. Okay, what muscle? Sternocleidomastoid. We have little different heads, but one of them does this, one of them does that. You got that one? Okay. Shrugging the shoulders. We call this shrugging. What muscle shrugs your shoulders? Thank you. And then we have that bending or nodding. What muscle is that? Sternocleidomastoid. You should know that. You all know what the word metastasis, metastasizing is? Y'all had pathology grant. That's next term. I'm going to do a couple.
Don't they associate that with like flies and flies and stuff?
What's that?
Like with flies?
Metastasizing?
Yeah, I always see like it has like a foot and it says this foot has metastasized and there's like flies coming out of it.
Well, that's a very strange thing. Everybody should know metastasis because when you're talking cancer, we'll be talking about that next term.
I like pizza.
When you have a, like a somebody is stage 1 cancer, a lot of times that just means it hasn't metastasized yet. Stage 4 is always metastasis. And that's when the cancer gets to other sites. We call it metastasis. The cancer can metastasize through the lymph nodes or through blood vessels or both. Okay? That's metastasis. So you should know that. I don't know why we have a question on that, but there it is. It has to do with the lymph nodes. You know what auricular means? The word auricular? Rectal, preauricular. What does that word mean? Ear. Has to do with ear. So preauricular in front of the ear. Yeah. We are getting there. Okay, we're on just a few more. Like 15 more. That's yeah, y'all know what primary is. Where's the maxillary third molars? Where do they drain?
Oh, deep cervical.
Yeah, superior deep cervical.
Superior.
Remember that? Okay, let's go over that one more time. Drainage of this area goes into what? Submandible. Okay. All of the teeth except their anterior lower teeth and the third molars go to submandibular, right? The maxillary third molars go to where? Superior deep cervical. Got it? That's a simplified version. It's not always going to be exactly that. That's just remember that for the exam. Does everybody have that?
Yes.
Okay. Now, it's on one piece of paper that I said to you on the lymphatics. It's all very simplified there. What drains what? I would know that. Okay. Tongue and teeth. This has to do with your world. You should know that. So anything involving tongue, teeth, pain, nerve that goes to the teeth, that's the most important. So we're probably going to ask you that more than anything else, right? And if we don't ask, you'll be all the smarter if you know it. Okay. We'll do that one. Okay, which is the most important? Not that too many questions on the arteries, which I'm very disappointed with. That's so much time on that. Okay, so we have the common carotid, right? And then we have the external and internal. The internal goes where? Up into the brain, right? And what brain does that go through? Internal carotid canal, right? Remember that? Okay, the one that goes to all the facial structure is branches of which one? External carotid. Right now we have some angry lady figured out PMS. Remember those? I hope so. We spent a long time on that. Okay? So, so if we're talking about the tongue, the teeth, all that stuff, what major artery would that be? Would that be the internal carotid? Would that be the common?
External.
External. Thank you. I like that. Nice and loud. Okay. Okay. We got that one. We're almost done. About 9 more questions. 8 more. Take that one. We got that one already. Oh, nose planes. This plane. What's that plane? I think there's just one question. This one. Mid-sagittal. Remember that one? And the one that goes this way. Remember that? Frontal, remember coronal, frontal. Look those up if you can't remember all of them. I'm not going to say so just, there's one question, but you may as well get that one right. It's not that hard. So know the planes. It's on the very second lecture, way back when. Just look at it and say, good, I know this. There's a couple. Maybe one. And also on that same lecture, we were talking about things like the separate, I don't know, the difference between the attached gingiva and alveolar mucosa and all those little pictures. I'd take a look at that. Do you remember a long time ago, surface anatomy? Just briefly go over it. Mostly it's pretty simple, right? But briefly, and mostly don't worry about the parts of the eye or the parts of the ear. What do you think we think is going to be the most important? I'm going to ask you one or two questions. Yeah, the stuff on the mouth and the gingiva. Know those. Don't worry about the canthers and the tragus. I don't think we're going to worry too much about that stuff. Okay? Because you have other exams also, correct? Yeah. Okay. This is another one on that same lecture. You remember the palate? And they have that soft tissue line that goes down the middle of the palate. Remember what that's called?
Carotid suture.
No, that would be on the bone. Soft tissue. Okay, that would be the bone. That's not a bad thing to know. Okay, but we're talking the soft tissue.
Secondary.
Soft tissue, we call it a raphe.
Oh.
Okay. Okay, what is the name of that rapé? Medium
Medium,
in the middle.
medium,
Palatine to the palate. Rapé. All a rapé, or wrap, some people call it, is it's like a seam when two soft tissues come together. We have a few rapés that we need to know about. Okay, and that's one of them. Well, what's it called again?
Medium palatine rapé.
Thank you. Yeah, that's a repeat too. Okay.
That one is easy. Can
Another
you repeat that?
And there's another one. Okay, now I don't know what else she's gonna ask about, but I'm gonna just, there may be some other questions. Don't, hey, I know them all. But as I'm looking at this exam, there's probably about 5 or 6 questions she's gonna have to redo because they're repeats. I don't want somebody that doesn't know one to get 5 wrong, right? Okay, so it's not fair. Okay, so we're gonna have to add a few, meaning, but they won't be, they're just gonna be basic things. Don't get crazy about this. Yes.
Can you make the font size big like how it was on your first exam?
Sure, I'll do that. I like big
Arial.
font. I love big font.
Yeah.
Yeah, I did better.
I test better.
Yeah.
The only problem, I hate to say this because I know you guys are as pure as the driven snow, is when you have not this class, but another class, we'd have great big fonts, great big everything, and this is what people would do. It's big font, then they circle the answer really, really big, and their hands would go, okay, you know, all right? That's the problem when the font is too big. And then we had somebody else that did this one. Nobody can do this. If you do, we'll take your paper away from you. They go, okay. They go like this, and then they put it like that. You see that D? They say, oh, D is the right answer. It happens to be right. Okay. And so the neighbors could go D. Okay? Got it. Do not do that. Okay, let me make sure you understand that. Yeah. Okay, we have people here to question the answers. This is a big no-no. If you see you do this, you're going to have your paper taken away. Okay? You all got that?
Yes.
Big no-no. You know what it is, you're going to circle it. That's fine. What you may not do is go, okay? We have people do that, and all they have to do is go like this, and their neighbor could see what the answer is.
That's so obvious.
But it was, don't do that. Okay?
How would you do it?
Now, the font size is another problem because the font is really big. Your neighbor, and this has happened too, you accidentally, you don't always know, we may or may not have the divider. Your neighbor could just accidentally look over there and then they see it and they go, oh, that might be right. Then they start second guessing and then both people get it wrong because your neighbor may not have it right. The neighbor's fault has happened. We laugh. We go, oh, look at this group. They're all together. They all got it wrong. We just laugh. So don't assume that your neighbor has it right. Even if you accidentally on purpose look at it, okay? But really, this is not a hard exam. You should not have to think, oh, I don't know it, and look at my neighbor. It's okay. Even accidentally on purpose, it should pick something up. It's not. Do your studying, give it a few hours, and you'll be fine.
But we can have one in that room, right? Are we going to be able to use both classrooms and kind of just spread out?
That would be really good.
Oh, yeah.
I think that would might